Okay. Good morning, everyone. It's an honor to be presenting here today. I have this very humble study to share with you guys. It talks about the bunoxanate-induced keratopathy, clinical patterns, and management at Cairo University. Okay. So Binox is the most commonly used anesthetic here in Egypt. It is sold over the counter and it is commonly used by welders, and it can lead to devastating ocular complications. So this is a retrospective study reviewing records between 2021 and 2025. We included any patient with binoxanate use for more than 1 month presenting to Qasr Al Aini Hospital for keratopathy or complications. And this is the standard cornea drawing we use to keep in our patients' files. So we have 36 eyes of 21 patients. 100% of them were males and 90% were welders. And the median vision was hand motion. So out of the 36 eyes, we had only 3 eyes seeing above 1.0 logmar. So the first thing we noticed is the presence of these circular raised stromal deposits. It was present in 24 eyes, and we found a negative correlation between the presence of these deposits and the presence of an abscess. We had roughly half of the patients presented with a corneal abscess, 4 of which were fungal, like the lower photo, and 13 of which were bacterial, like the upper photo. And then all patients except one had very large epithelial defects, which we quantified as a surface area in millimeters squared. So other findings, we had 5 eyes presenting with perforations, 8 eyes presenting with marked thinning, and 4 eyes presenting with hypopyon as well. So the management. The patients were either managed medically or surgically. 17 eyes had medical treatment, which was an antimicrobial, either an antibacterial or antifungal, depending on presentation, a preservative-free lubricant, and insulin eye drops, and I will get to that later. We also gave them systemic vitamin C for the reepithelialization and doxycycline to prevent the stromal melting. 19 eyes received surgical treatment, which was mostly amniotic membrane grafts. We only had 1 patient with a conjunctival flap and 1 patient with a tectonic graft, because he was a single-eyed patient presenting with a very large perforation. We found by logistic regression that the larger the epithelial defect and the worse the presenting vision, the higher the likelihood that the patient would receive a surgical option. You can see on the left-hand side, this is a typical amniotic case, and on the right-hand side, this is the tectonic patient. So how do topical anesthetic works? They block the sodium channels and thus prevent pain sensations. What this translates to us is that they reduce the blink rate and abolish the touch sensation from the cornea. So the pathophysiology of the binoxanate-induced keratopathy is 2 things. First, there's the neurotrophic element, and secondly, there's this disturbance in the ocular surface homeostasis, mainly by the preservatives, the benzalkylate chloride. This is aggravated by the low tear production due to the neurotrophic element. So interestingly enough, we had 1 patient with this markedly raised deposit that we took and sent for pathology, and we only found very marked fibrosis. And we explained that by the increased expression in transformational growth factor beta, which is usually expressed in high quantities in denervation injuries all over the body. So what about the corneal abscesses? Roughly 50% of our patients presented mainly with a secondary infection. Most of the patients were welders, so they experience foreign body traumas. Also, there is this marked destruction of the epithelial barrier, both due to the benzalkylate chloride and the neurotrophic element, and also because of the poor hygiene of the patients. So usually these patients present extremely late when the vision is extremely affected. You have to have a really high index of suspicion because really early on they really resemble acanthamoeba keratitis, and usually these patients have an addictive behavior. So you have to inquire about the eye drop with the yellow label, and we teach our residents that you have to ask about it and you have to show the patient where it belongs. So in the end, I just want to say that binoxanate-induced keratopathy is a preventable, sight-threatening disease, and we really need strict regulation in Egypt to prevent ease of purchase. Thank you.